This is the Therapy Chat Podcast with Laura Reagan, lcsw-c. The information shared in this podcast is not a substitute for seeking help from a licensed mental health professional. And now, here's your host, Laura Reagan, lcsw-c.
Hi, welcome back to Therapy Chat. I'm your host, Laura Reagan, and this week, in our fourth of the 5 episodes recorded at Psychotherapy Networker in partnership with PESI, I was so fortunate to interview someone I really respect and admire, recipient of a Lifetime Achievement Award at this year's Psychotherapy Networker, Dr. Janina Fisher. I have to tell you, it's funny that we were talking about shame, and I was so rattled during and after our conversation because we had so many, my tech setup had so many technical problems with the sound. Dr. Fisher was graceful and patient like she is, but unfortunately, this was a very short conversation because only 20 minutes of it was recorded. So I think what we were talking about is very interesting. I thought it was very interesting as a trauma survivor and a trauma therapist. We were talking about shame as an adaptation to help children when they need to be seen and not heard. You know that expression, children should be seen and not heard. Children are usually heard because they're noisy, they're chaotic, they're wild, they're running around, they're doing whatever they feel like doing, they're screaming, they're yelling, crashing into things, breaking stuff, and that's normal behavior of kids, but so many families can't tolerate the exuberance and life force of a child due to the parents' challenges with, whether it's their own trauma history, the stressors that they're dealing with. It's just too much. And many parents would be abusive to silence their children, and others, it's more of an attachment process where you don't get approval when you're being noisy and being a kid, but you do get approval when you are stifling the emotions that your parent can't handle. So in this conversation, as brief as it is, you'll hear Dr. Janina Fisher talking about a little glimpse of how she was teaching about shame at the Networker this year. Of course, in the show notes, we have a link to some discounted offers from PESI to learn from Dr. Fisher with her home study courses through them. She talks about how shame is an adaptation, how it develops and why, and how it's also getting in the way in adulthood when people come to therapy, as I described from my own experience, how shame was there affecting me, but it was kind of hidden. And she pointed out that for many people, that is one of the last layers of healing that needs to happen. And I will say too, from my own experience and that of clients I've worked with, that there's so much grief in recognizing the way that shame has prevented us from living in our full expression. And there's hope, because once you realize that that's what's going on, and it's not true, as she says, that you, quote, didn't deserve. In other words, when you feel like there's something wrong with you and you aren't deserving of the love and kindness and the good things in life and the things that you want, the achievements that you would like to make, the things you would like to try, and you feel like, well, that's not for me. It's very liberating and empowering to decouple that from true sense of who you are. So I'm so grateful to Dr. Janina Fisher for being my guest on Therapy Chat today. She is such a leader in our field. I have learned from her so much, and one of our TTN members, John Lee, gets a shout out in this episode. So I invite you to settle in and get curious about shame, how it might be showing up in your life, and if you're a therapist, how it also might be showing up in your clients' lives, and think about these ideas that she shares for working with shame, and then go and learn more from all of the wonderful trainings that Dr. Janina Fisher offers, including the ones in the link in the show notes, which are discounted for you. Thank you, as always, for listening. Hi, welcome back to Therapy Chat, broadcasting live from Psychotherapy Networker. And now I'm so grateful and happy to be sitting with someone who I just look up to so much, and previous Therapy Chat guest, Dr. Janina Fisher. Thank you so much for being here.
My pleasure.
You were just honored with like a Lifetime Achievement Award.
Yes.
Congratulations.
It made me feel very old. and it reminded me that, I never set out to achieve anything. I just set out to try to improve the quality of trauma treatment and educate trauma therapists, because there is just, as you know, such a need for it.
Oh, yeah. And you have achieved, even though you didn't set out to, so much. And your voice, and I'm especially glad as a woman that you are out here with other great leaders like Pat Ogden, really, changing the therapy world from your own unique perspective and the trauma therapy world. So I know your work isn't done, but I'm very grateful for everything that you have done and that I've learned from you at TIST model. I was, I'll just tell you real quick. I was at, I have a membership community, and I went to dinner with some of the members of the community, and one of them is someone who's certified in TIST. I don't know if you'll remember John Lee. And
of course.
Yeah. And
John was wonderful.
Yes. And John was like, I'm going to be assisting Janina, and talking about how it changed their practice. And it's just, these are like the ways that we connect as therapists who really care about helping people heal after trauma. And just, I think feeling the impact that we all have is very heartening for the future of the work and our sustainability in the field.
Right. We know so much more than we ever knew 20, 30 years ago.
Yeah.
40 years ago, actually. If I think, no, it couldn't be 40. I'm not that old. But 30 something years ago. Yeah.
Yeah. So let me ask you, what are you doing here at Psychotherapy Networker besides receiving awards and being admired by so many people?
Well, I'm teaching 2 workshops on 2 of my favorite topics. One is a workshop on trauma-related shame and how to understand shame and address it more successfully than we're usually able to help people do. And the other workshop is a workshop on traumatic memory.
Well, that, the shame piece is something that I think we hear about shame, but I don't know how well people really understand it and how it relates to trauma. But it's, as a trauma survivor, I think for myself, I've realized how much I was really driven by shame for so long. And to me, it's like attachment related. But then it, adds the traumatic experiences I've had beyond childhood and adulthood, and there's just this feeling of like, if I had done something differently, if I had been different, this wouldn't have happened, or the way I feel is my fault,
Right. And so, what led me to create the workshop is just seeing how deeply embedded the shame is, and how for many people, luckily not for you, it really is like an obstacle to having a full, rich life. They're always held back by the beliefs that they're worthless, by the feeling of I don't want to be seen, and and by the feelings of I don't deserve to feel good about myself. So from a trauma perspective and an attachment perspective, shame is a way, it's an adaptation to trauma and attachment failure. That's the whole point of the workshop, is understanding shame as a survival response, rather than tying it to the details of what happened. So mostly we have tended as a field to focus on when you're treated abusively, you feel shame, and that shame lasts and lasts and lasts, as opposed to when you're treated abusively, shame enables you to submit at ages where you're too young to fight back, too young to protest, it's too dangerous to cry, and the shame allows you to comply, adapt, be the child that gets a few more attachment crumbs. And so that is a whole different perspective on shame and much more easily treatable. I mean, I spend years telling people, it's not your shame, it's the perpetrator's shame. And it just went over their heads.
Yeah.
It was not, they couldn't process.
Yeah.
This, in retrospect, it was kind of an intellectual idea that the perpetrators should be ashamed, and they were carrying the perpetrator's shame. It just changes the whole conversation when you start to look at shame as a way they survived and to celebrate it as a survival response, which still helps them to be in a different relationship to it. And that's really my perspective. I think really somatically informed perspective that whatever we're feeling, we need to have a relationship with it rather than drown in it.
Yeah.
And so often people drown in their feelings, which makes them more phobic of those feelings, which, often triggers shame. And so once you establish a relationship to a feeling, it gives you more creative freedom for how to what to do with it. And to look at I don't deserve as an adaptation as opposed to a truth really changes the whole way of relating to shame.
Yeah, as I think about it, it's like, it's one thing when I'm thinking from my therapist's brain.
Right.
And it's another thing when I'm thinking from my own experiences of my life. Like when I think about shame, I know that for many years, I was phobic of feeling ashamed because it's like, you feel ashamed that you're ashamed.
Exactly. It's what I call shame of shame. And it's this vicious circle where it confirms your worst fears about yourself, which triggers more shame, which reinforces all those beliefs, which reinforces the shame. And it's what I call the vicious circle of shame and more shame. And for so many people, when you're trapped in it, I mean, I've worked with clients who literally can't do more than go to work and come home because the shame makes them so avoidant of everything. And it becomes a self-fulfilling prophecy because that shame-related belief, I don't deserve, means that people don't treat themselves as deserving. And so the more we treat ourselves as undeserving, the more undeserving we feel. So it really, I see shame as a huge obstacle to healing. And it's interesting for you to say it was kind of the last thing to heal.
Yeah. Yeah.
And I think that's true for many, many, many people.
Do you have any, I know many things, and you can riff on anything I ask you, I'm sure, but how do we work with that? When people don't, it feels like you don't know you're having shame. You think you are worthless.
Right. And so I always start by, we're trained to respond empathically. Like it's so hard to feel you don't deserve anything. But that doesn't challenge the shame. If anything, it reinforces it, because it says it sucks to feel so much shame, but it doesn't in any way challenge the feeling that the shame is true. And so what I like to do is to start by reflecting back. Instead of empathy, I reflect back. That's an ingenious belief. That's a brilliant survival strategy. And the clients go, huh? And so I'm looking for the huh. I'm looking for that little bit of confusion, because that means I disrupted this kind of closed circuit. And they look, what? I say, that's a brilliant survival strategy. Because if you don't deserve, you're going to comply, you're going to pour oil on the troubled waters, you're going to make sure that you don't ruffle anybody's feathers. And that's safer. So that's kind of the beginning of the conversation. I find that if I tried just taking a more mindfulness-based approach, which I really believe, but when I would say, oh, you're having the thought you don't deserve, they'd say, you don't understand. It's not a thought. It's the truth.
Yeah.
And then you're kind of stuck as a therapist, because you can have a conversation where you're saying, no, it's not the truth. And the client says it is the truth.
Yeah.
Right? So I found that what works the best is just this really repetitive, brilliant. And how did that help you survive? What would have happened to you if you hadn't had the shame? And then they start to actually think, yeah, what would have happened to me without the shame? And most people pretty quickly say, oh, if I hadn't had the shame, I might have failed to be, seen and not heard. Right? So the shame is a highly effective, really somatic intervention that allows children are not good at being seen and not heard. They really suck at it.
Yeah.
As you know. And so you need the shame to keep you seen and not heard. And again, there's no kind of ta-da, brilliant insight moment. But if, I always say it took many, many, many repetitions to reinforce the shame. It's going to take many repetitions to overcome it.
Yeah.
So but as a therapist, you can be patient with all those repetitions if you're not having to sit and listen to somebody beat themselves up week after week after week after week. I think that's very, very tiring and demoralizing as a therapist. You see your client suffering in that way. And there's really not much you can say that doesn't get met with some fight to keep the shame, which I also think is a survival strategy, because I think the body and the mind tend to hold on to the survival strategies that allowed us to get through.
Yeah. It's like, I can see how it's protective in a way. It's adaptive, it's protective in like keeping you from, I mean, is your position in the way you're teaching about this that the shame is, well, let me just ask you, what's the function of the shame? How is it helping?
Well, it isn't helping now because, when clients are past the point of needing to survive and please people who could be dangerous or could abandon them, which is the fear in attachment failure, it's necessary. It isn't necessary at the point that we usually see clients. Yeah. At that point, it's holding them back.
Yeah.
But to change their relationship to it requires helping them appreciate that without it, they literally, in some cases, could have been killed.
Yeah. So it's to avoid being abused. You become submissive.
Right.
And it may not look like submissive to the outside, but that's the process.
Right. And we know, whether you take a polyvagal point of view or an animal survival defense point of view, in the end, every model of survival defense contains a submission response because, children, victims of domestic violence are literally trapped. And so they can't fight, they can't flee, they can't socially engage. All they can do is submit.
So would you say a little bit about, for, say, an adult who's going to therapy, how would they know what would shame look like showing up in their life?
I mean, sometimes it's they come in saying, I'm so ashamed, I'm so ashamed. Or they come in and say, my boss yelled at me at work and I'm so ashamed. Somebody bumped into me on the street and I apologized 10 times. Or I've just been preoccupied with how worthless I am. Why would I expect that people would like me when I'm so worthless? So it usually comes up in the story that the client is telling in each session.
Yeah. Yeah. But it sounds like you're also talking about like maybe, because I think I'll say clients that I have worked with over my time as a therapist, there's often a very likable personality that you are working with, and you're like, they're saying, I hate myself, but they seem so pleasant and so likable. And you're like, I don't get it. What's the disconnect here?
Right. And usually the therapist tries to challenge the shame by saying, but you're not those things, right? I don't experience you that way. And the client fights us. You don't understand. I thought you understood. How could you say I'm a nice person if you really truly understood me? So usually it doesn't work. I mean, that's what's, I think, so frustrating for therapists is the relationship works well for fear, for anger, for sadness. It doesn't work for shame. Because our experience of the client doesn't fit with the client's reality.
Yeah.
Right.
Thank you for listening to Therapy Chat with your host, Laura Reagan, LCSW-C. For more information, please visit therapychatpodcast.com.